Did you know that cancer is one of the leading causes of death worldwide? It's a scary thought, but here's the good news: early detection can make all the difference. When caught early, many types of cancer are not just treatable, they're curable. In fact, for some cancers like thyroid cancer, the survival rate is over 99% if diagnosed in time. That's why it's so important to pay attention to the signs your body might be giving you. Sometimes, even the smallest or most subtle symptom could be a warning that something isn't right. By recognizing these signs and seeking medical attention promptly, you can dramatically improve your chances of recovery or even prevent cancer from progressing. So, let's dive in. Here are the 10 most common warning signs of cancer that you should never ignore, because your health is worth it. Number 1. Extreme fatigue. Fatigue is something we all experience from time to time, but there's a big difference between feeling a little tired and being completely drained no matter how much rest you get. Extreme, persistent fatigue is one of the most overlooked warning signs of cancer, yet it can be an early clue that something isn't right in your body. Unlike normal tiredness, cancer-related fatigue doesn't improve with rest. It can feel overwhelming, making even the simplest tasks exhausting. While fatigue alone doesn't automatically mean cancer, when it's severe and persistent, it's a sign that deserves attention. Cancer-related fatigue often happens because the disease interferes with the body's ability to produce healthy red blood cells, leading to anemia. This means your body isn't getting enough oxygen, making you feel weak and sluggish. Tumors also consume large amounts of energy, leaving less for your body to function normally. Additionally, some cancers disrupt metabolism and glucose regulation, further draining your energy levels. So, how do you know if your fatigue is something more serious? Watch for key signs like waking up feeling exhausted despite getting a full night's sleep, struggling with activities that used to be easy, or experiencing shortness of breath when climbing stairs. Other red flags include weak nails, hair loss, dizziness, and even heart palpitations. If you've been dealing with extreme fatigue that won't go away, don't ignore it. A simple blood test can check for anemia, vitamin deficiencies, or glucose imbalances, issues that, if caught early, can make a huge difference in your overall health. Number 2. Unexplained bleeding. Bleeding is something most of us associate with an injury, but when it happens unexpectedly, without an obvious cause, it can be a serious red flag. Unexplained bleeding is one of the most overlooked warning signs of cancer, yet it's a symptom that should never be ignored. Cancer can cause abnormal blood vessel growth, making them fragile and more prone to bleeding. While some types of bleeding may be visible, others, like internal bleeding, may go unnoticed until the condition becomes severe. There are several types of unexplained bleeding that could indicate cancer. Blood in the urine, for example, may be a sign of bladder or kidney cancer. If you notice blood in your stool or black, tar-like stools, this could be a sign of colorectal cancer, where digested blood gives stool a dark appearance. Coughing up blood may indicate lung or throat cancer, while unexplained vaginal bleeding, especially after menopause, could signal cervical, uterine, or ovarian cancer. Frequent nosebleeds, particularly when accompanied by easy bruising, may be linked to leukemia, a cancer that affects the blood and bone marrow. So, what should you do if you experience unexplained bleeding? Don't ignore it. Even if it only happens once, it's worth discussing with your doctor. Persistent or recurring bleeding should be investigated immediately. Depending on the suspected cause, your doctor may recommend a colonoscopy, endoscopy, CT scan, or blood tests to determine the underlying issue. The sooner the cause is identified, the better your chances of effective treatment. When it comes to cancer, early detection can make all the difference, so if you notice any unusual bleeding, seek medical attention as soon as possible. Number 3. Blood clots and thrombosis. Blood clots are a serious and often unexpected health risk, but did you know they can also be an early warning sign of cancer? Many people associate blood clots with conditions like heart disease or prolonged immobility, but cancer significantly increases the risk of deep vein thrombosis, DVT, and pulmonary embolism, PE. In fact, some cancer patients die from clot-related complications rather than the cancer itself. That's because cancer can make the blood more prone to clotting, leading to dangerous blockages in veins and arteries. But why does this happen? Cancer cells release substances that interfere with normal blood clotting, making the blood thicker and more likely to form clots. This is especially common in cancers of the pancreas, lungs, brain, and stomach. Certain risk factors, such as smoking, obesity, and prolonged inactivity, can further increase the likelihood of clotting. If you have cancer or a history of unexplained blood clots, it's important to stay vigilant. So, what symptoms should you watch for? Swelling, redness, and pain in the legs may indicate deep vein thrombosis, DVT, where a clot forms in a deep vein, usually in the lower leg. A pulmonary embolism, PE, happens when a clot travels to the lungs, causing sudden shortness of breath, chest pain, and dizziness. This is a medical emergency that requires immediate attention. If you develop a blood clot without an obvious cause, such as a recent injury, surgery, or extended bed rest, it's crucial to insist on further testing. Blood tests, Doppler ultrasound, or a CT scan can help identify underlying conditions, including cancer. Don't ignore the warning signs. Unexplained blood clots can be a silent red flag that something deeper is going on in your body. Seek medical advice right away. Number 4, skin changes and melanoma. Your skin can reveal a lot about your overall health, and when it comes to cancer, it often gives early warning signs, if you know what to look for. Melanoma, one of the most aggressive forms of skin cancer, can be deadly if not caught early. However, the good news is that early detection dramatically increases survival rates and can prevent it from spreading to other parts of the body. That's why paying attention to changes in your skin is so important. One of the biggest red flags of skin cancer is changes in moles or the appearance of new growths or sores that don't heal. If you notice a mole that suddenly gets bigger, changes shape, has an irregular border, or starts to itch or bleed, it's time to take action. Even a small change could be a sign that something more serious is going on beneath the surface. So, how do you know if a mole or skin spot is concerning? Use the ABCDE rule. A. Asymmetry. One half of the mole looks different from the other. B. Border. The edges are uneven, blurred, or irregular. C. Color. The mole has multiple colors, such as brown, black, red, or even blue. D. Diameter. It's larger than 6 millimeters, about the size of a pencil eraser. E. Evolving. The mole keeps changing in size, shape, or texture. If you notice any of these signs, don't wait. See a doctor or dermatologist immediately. Skin cancer is highly treatable when caught early, but delaying a diagnosis can be life-threatening. Regularly check your skin and don't ignore changes. Your awareness could save your life. Number 5, unexplained weight loss. Losing weight without trying might sound like a good thing at first, but when the weight loss is sudden and unexplained, it can be a serious red flag. If you've lost more than 10% of your body weight within 6 months without changing your diet or exercise routine, it's time to pay attention. While stress, lifestyle changes, or other medical conditions can sometimes be the cause, unexplained weight loss is often an early warning sign of cancer. Cancer can significantly alter your body's metabolism and appetite, making it difficult to maintain your normal weight. Cancers of the pancreas, stomach, lung, and esophagus are especially known for causing severe weight loss. Some tumors release chemicals that disrupt how your body processes nutrients, leading to muscle wasting, cachexia, loss of appetite, and a sensation of fullness even after eating small amounts. If you feel like you're constantly losing weight without any effort, it's essential to take this symptom seriously. Other warning signs that might accompany unexplained weight loss include loss of appetite, feeling less hungry than usual or skipping meals without realizing it, feeling full quickly, eating only a small portion before feeling completely satisfied, muscle loss and weakness, a decrease in muscle mass, making daily activities feel more exhausting. So, what should you do if you notice these symptoms? Don't ignore them. See your doctor as soon as possible for a full evaluation, including blood tests, imaging scans, such as CT scans or MRIs, and metabolic assessments. Detecting cancer early can dramatically improve treatment options and survival rates, so if your weight loss seems unexplained, take action before it's too late. Number 6. Swollen lymph nodes. Lymph nodes play a crucial role in your immune system, acting as your body's first line of defense against infections. They filter out harmful substances and help fight off bacteria and viruses. However, when lymph nodes swell without any clear reason, it could indicate something more serious, such as leukemia or lymphoma. While swollen lymph nodes are often associated with infections like the flu or a cold, persistent or painless swelling could be an early warning sign of cancer. So, what are the red flags to watch for? Swollen lymph nodes in the neck, armpits, or groin that appear without an infection and don't go away. Painless lumps that keep growing. Most infections cause tender, swollen lymph nodes, but cancer-related nodes often aren't painful. Firm or rubbery texture. Lymph nodes affected by cancer may feel harder or more solid than normal swollen glands. Multiple swollen nodes in different areas. While a single swollen node could be a local infection, cancer-related swelling may appear in multiple locations. If your lymph nodes remain swollen for more than 2 weeks, especially if they continue to grow, don't ignore it. A doctor may recommend further tests such as blood work, ultrasound, CT scans, or a biopsy to determine the cause. Early detection of leukemia, lymphoma, or other cancers that spread through the lymphatic system can dramatically improve survival rates. If you notice persistent, unexplained swelling, get it checked out immediately. It's always better to investigate a symptom early rather than wait until it progresses. Number 7. Persistent pain. Pain is something we all experience, but when it becomes chronic, worsening, or unexplained, it could be more than just an everyday ache. It might be a warning sign of cancer. Unlike temporary pain caused by an injury or muscle strain, cancer-related pain doesn't go away and often gets progressively worse. While not every persistent pain is linked to cancer, ignoring it for too long can allow a serious condition to go undetected. Types of pain that may signal cancer. Severe, persistent headaches. If you have ongoing headaches that don't respond to usual painkillers and worsen over time, it could be a sign of a brain tumor, especially if accompanied by nausea, vision problems, or dizziness. Abdominal pain. Unexplained stomach or back pain that lingers for weeks may indicate pancreatic or liver cancer. These cancers often go undiagnosed in the early stages because their symptoms are vague. Bone pain. If you experience deep, aching pain in your bones that doesn't seem related to an injury, it could be a sign of bone cancer or metastasis, cancer that has spread to the bones. This pain is usually more intense at night and doesn't improve with rest. If you have ongoing pain that lasts for weeks or keeps getting worse, don't dismiss it. A doctor may recommend imaging tests like MRI, CT scans, or even a biopsy to determine the cause. The earlier cancer is detected, the better the treatment outcomes. Pain is your body's way of signaling something is wrong. Listen to it and take action before it's too late. Number 8. Changes in bowel habits. Your digestive system is a strong indicator of overall health, and when your bowel habits start to change for no clear reason, it could be a sign of something serious. Long-term constipation, persistent diarrhea, or difficulty swallowing aren't just uncomfortable, they could be early warning signs of digestive tract cancers. While occasional stomach issues are normal, ongoing or unexplained changes in your digestive patterns should never be ignored. If swallowing solid foods has become challenging, or you feel like food is getting stuck in your throat or chest, it could be a sign of esophageal cancer. This symptom often starts subtly but worsens over time, eventually making even liquids difficult to swallow. If you've been experiencing long-term constipation or diarrhea without an obvious cause, it may indicate colon cancer. A tumor in the colon can either slow down digestion, leading to constipation, or cause irritation and inflammation, leading to diarrhea. Thin, ribbon-like stools may suggest a partial blockage in the colon, often caused by a growing tumor. While bright red blood may come from hemorrhoids, dark or tarry stools can be a sign of internal bleeding from colorectal cancer. If you experience persistent changes in your bowel habits, don't ignore them. The best way to detect colon cancer is through a colonoscopy, which can identify tumors and precancerous growths before they become life-threatening. Early detection is key. If you notice any of these symptoms, consult a doctor immediately. Number 9. Night sweats and fever. Waking up drenched in sweat can be uncomfortable, but when night sweats happen frequently and without a clear cause, they could be more than just an annoyance. They might be a warning sign of an underlying health issue, including cancer. While occasional night sweats can result from hormonal changes, stress, or infections, persistent, unexplained night sweats, especially when accompanied by fever, may indicate lymphoma or leukemia. Certain types of cancer, particularly lymphoma and leukemia, can interfere with the body's ability to regulate temperature. As a result, the immune system may react by raising body temperature, triggering excessive sweating, especially at night. Fever and night sweats often appear in cycles, with temperatures rising in the evening and breaking overnight, leading to profuse sweating. Other symptoms that may accompany night sweats and fever: unexplained weight loss, losing weight without dieting or exercising, persistent fatigue, feeling weak and exhausted even after adequate rest, swollen lymph nodes, painless lumps in the neck, armpits, or groin, frequent infections. A weakened immune system can make you more prone to illness. If you're experiencing excessive night sweats without an infection or other known cause, don't ignore it. See a doctor for a thorough medical evaluation, including blood tests, imaging scans, or a lymph node biopsy if necessary. Early diagnosis of lymphoma or leukemia can significantly improve treatment success rates. If something feels off with your body, trust your instincts and get checked. Your health is worth it. Number 10. Growing nodules or lumps. Not all lumps are cancerous, but any new, growing, or unexplained lump should always be checked by a doctor. Many cancers, including thyroid, breast, and abdominal cancers, start as small nodules that slowly increase in size. While some lumps may be harmless cysts or benign growths, others could be early signs of cancer, making early detection absolutely crucial. Where are high-risk lumps most common? Thyroid nodules. Thyroid cancer is one of the most treatable cancers, with a 99% cure rate when detected early. If you notice a lump in the front of your neck that doesn't go away, gets larger, or affects your voice or swallowing, it should be evaluated. Breast lumps. One of the most well-known signs of breast cancer is a lump in the breast or underarm area. While some lumps are harmless, cancerous lumps tend to be hard, painless, and immovable. Women and men should perform regular self-exams and report any changes to a doctor. Abdominal or other lumps. A lump in the abdomen, groin, or other areas could be linked to organ tumors, hernias, or swollen lymph nodes. If a lump continues to grow, feels firm, or is accompanied by pain, weight loss, or digestive issues, further testing is needed. If you notice any lump that is growing, persistent, or changing in texture, don't wait, get it checked. A doctor may recommend ultrasound, CT scans, MRI, or a biopsy to determine whether it's benign or malignant. Catching cancer early significantly improves survival rates. So, if something doesn't feel right, trust your instincts and seek medical advice. Your health is too important to ignore. Cancer is far easier to treat, and even cure, when caught early. That's why recognizing these warning signs and seeking medical attention promptly can save your life. Many of these symptoms, like unexplained weight loss, persistent pain, or changes in bowel habits, may seem minor at first, but they could be your body's way of signaling something serious. Don't ignore them. If you notice any persistent, unusual symptoms, consult a doctor as soon as possible. Early detection means better treatment options and a higher chance of survival. If you found this information valuable, please like, share, and subscribe for more health-related content. Your awareness could help someone else recognize a life-saving symptom. Stay informed, stay healthy, and take care of yourself.